Can you hear me?
Yes. All right. So, hello and good afternoon to Miss Joanne. Thank you so much for taking the time to be with us today and help us with our group assignment on intercultural communication. I am Sarah Hanina.
And I am Siti Aisha.
I am Zahra Anissa.
Uh, Before we begin, could you please introduce yourself and briefly share about your background?
Yeah, hi everyone. My name is Joanne. I'm currently working as a rehab trainer. So yeah, I work with a lot of athletes in most of the sports are swimming, squash, badminton, and basketball. Yeah.
All right. So, the first ice-breaking question. Um, can you tell me a little bit about your childhood experience growing up?
I grew up in a very diverse environment in Malaysia, so I was used to hearing different languages and seeing different customs every day lah. Yeah.
Do you know or understand what intercultural communication is?
I guess it's basically how we manage the gaps when talking to people from different backgrounds and to make sure the message is transferred clearly.
Um, all right. So, have you ever encountered a misunderstanding when you are communicating with someone outside of your culture? If so, what kind of misunderstanding? Was it a verbal or non-verbal?
Usually non-verbal because sometimes like a nod or a smile is interpreted differently very on person. So I've learned how to double check by asking my patient more questions lah. Yeah.
All right. So the first, we're going to get into the interview question now. So the first one is, so do you find yourself switching between Bahasa Melayu, Mandarin, and English depending on who you're speaking to at work or in daily life? And what does each language represent for you in those situations?
I would say all the time because I see different races of patients, Indian, Malay, Korean, Chinese. So yeah, I use English mostly for medical terms, but I can switch to Mandarin or BM to make sure my patients feel more comfortable and understood lah. So make sure there's no language barrier. Yeah, they can understand me, I can understand them better.
Um, As a physiotherapist, how do you balance the value of harmony with the need to express your professional opinion clearly in intercultural interactions?
I would say I'm using a soft approach, so I'm giving my advice respectfully, so the patient doesn't feel pressure. Yeah, which keeps our relationship positive lah. Because I don't want to let them feel like they're coming in a clinic, so everything is straight down. Yeah, they can feel lively and happy while they are in here lah.
So, would you say that you usually try to use a more softer approach with them?
Yeah, correct.
Um, at work, do you change how you explain things when speaking to senior staff compared to younger patients? And how does this relate to the understated style of communication?
Yeah, I think I'm much more formal and understated with seniors to show respect and their age and of course their position. If it's like younger patients or even my age, I'll make sure I sound it like I understand them and I'm able to get them talk to me, communicate. So I don't want to just let them come here and do whatever they have to do without expressing how they feel in here. Yeah.
So if I would, so you basically would, so with older patients, you tend to be a little bit more formal compared to younger ones.
Yes, correct.
And when you interact with supervisors or healthcare professionals from different cultural backgrounds, do you use more formal language or adopt any strategies to bridge the cultural gap?
Like I said, definitely I use more formal language to adjust my style to match with theirs. So just to make sure I work more smoothly lah. Because different people, different frequency, I would say. Because I can't use medical term to you or to anyone that doesn't understand sports or even something related to medics. Yeah, so we'll try to adjust every time we speak to each person.
All right. Can you recall a clinical interaction where a Mandarin term and its Bahasa counterpart needed to be clarified for the patient or colleague? How did you reach a shared interpretation?
Mm, so usually we'll start off with English, of course, because we something like rehabilitation. It's we don't use much in Mandarin. So I'll focus on explaining the goal of their treatment rather than just the words lah. So they can know exactly what to expect. Not just, oh yeah, you're here for your rehab. So but they don't understand what rehab is. Yeah.
So would can you like explain further on that? I mean like when you are like interacting with them, like you use how do you explain to
Mhm.
them? Like
Sorry, 1 second. Yeah. Uh, yeah, sorry about that. Yeah. So sorry, do you mind repeat the question again?
so basically, like you said earlier, you mentioned earlier that usually you would explain to them. So can you like further um, clarify, like in detail, like how you usually would explain when you are with the patient for the, uh, rehabilitation or in medical terms?
Yeah. Okay. So I guess there's a word in the end, rehabilitasi, and of course Mandarin is called fujian. So to some patients, this might imply a very disciplined or repetitive process of restoring strength for Chinese people. So for most of the Malay, if they understand rehabilitasi, that might sound more like a clinical hospital process or even just ask you to rest until you feel better. Because so like if we tell a patient we're studying rehab, then they think rehab means resting at home lah, but you mean doing more painful exercise. So there's like a misunderstanding of the treatment goals. So um, sometimes mostly they thought rehab is just massage. So meanwhile they have to do more exercise lah. So by clarifying this, I'll tell them that we are in partners this. So I get you, you do the movement. So just to ensure we have the same goal lah. Yeah, guys, I answer your question.
Yes, thank you. So we're moving on to the next chapter, and I'm giving this to Aisha.
Yeah, sure.
All right. So, based on my readings, I found that Chinese culture rely on nonverbal clues such as facial expressions, body language, and gestures, which carry significant weight and meaning. How does this experience differs to you when you are communicating with a Malaysian and a Chinese?
Mm, in that case, I do realize that our Chinese patients might rely on more subtle facial cues, or others Malaysians tend to use more direct gesture or body language. Um, because I think they expect me to read between the lines, lah, see if they are comfortable or in being. Yeah.
Mm.
So they won't, for Chinese they won't directly say I'm not comfortable, I'm uncomfortable, I'm in pain. So they're probably just like they just clench their eyes or change their posture. Yeah, as you expect, you have to notice those clues lah. Mm.
Okay. Have you ever experienced discomfort related to gestures, personal space, or touch when working with patients or colleagues from different cultural backgrounds, and why?
Um, since what I do here is mostly hands-on, so I will always explain what I'm doing first, because this avoids any cultural discomfort regarding personal space. Yeah,
Mm-hmm.
like sport massage, I have to really touch them so I can proceed the procedure. And then
Mm-hmm.
even though it's rehab or strength training, yeah, you gotta work with it. As long as they're okay, I got the permission, then that's fine. Yeah, to me it's fine. For them, I have to just double
Okay.
confirm.
All right, I get you. And next, do you apply Confucian values in your interaction with patients? If so, how do Confucian ideas of harmony and hierarchy shape the way you use facial expressions? For example, like smiling and
Mm-hmm.
nodding in everyday interactions. Okay,
Right. Yeah.
it's okay.
Um, I definitely use them. So the most common one is smiling and nodding lah, just to still it's just to let the patient know that I am listening, that I
Mm-hmm.
also care about their recovery. Yeah.
Mm-hmm.
So I use this to show respect for hierarchy, of course, especially with the older patients, and let them just make sure they feel honored and safe in my care. Hmm. So I think this is all about what I'm doing here is just all about showing empathy and support. So a simple nod to help the patient feel emotionally present. Mm, yep.
Okay. Um, So, sometimes when you disagree with your colleagues or
Mm.
patients from different cultural backgrounds in your work, do you usually express your disagreement directly or indirectly? And why do you prefer that approach?
I think this depends because, like, for daily interaction, I stay indirect to be
Mm-hmm.
respectful and also maintain the harmony.
Mm-hmm.
However, if a patient is doing something that might hurt them, I will switch to a more direct approach because their safety is the priority lah. Yeah.
Okay. So I will pass the next questions to Zara.
Yeah.
Okay, so the last question is, can you describe a conflict you experienced with someone from different cultural background and explain how cultural value and language differences influence the way the conflict developed and was resolved?
Okay. I think I once had a younger patient that wanted progress quickly. You know how a youngster wants, right? Yeah. So he wanted fast, but his older parents were very protective and quite traditional and wanted him to rest more, which was also kind of slowing down his recovery progress. So what I did was, of course, I respect the parents' authority, but I have to explain the science behind the active recovery to their family. So once they understood the goal, we can find a middle ground that keep everyone happy lah. So that's it.
That is all from us.
Mm.
Thank you so much for taking the time to be interviewed because I know and you're very busy and you
I'm
got
so
a lot of
sorry about keep
things. No,
rescheduling.
it's okay. But thank you so much. We really
Mm.
appreciate you for helping us to complete our assignment.
Mm.
And may everything goes well for you and your career. Thank you so much, Miss Joanne.
Thank you, all of you.
Thank you,
Thank you.
Mr. N.
Thank you so much.
Okay, bye.
Thank you.